Hi everyone, today I am going to talk about sulfuric acid poisoning. Pure sulfuric acid has no color, no smell, it does not produce fumes, and it has a tendency to absorb moisture. And manufactured sulfuric acid is brown or black in color. Sulfuric acid is a very strong acid. It can cause superficial burns after 1 second of contact. It removes the superficial layer of the skin, and it can also cause full thickness burns after 30 seconds of contact. As you can see in this picture, this man has taken sulfuric acid. Because of that, he has black marks around his mouth and over his neck. And on the left side, chalky white teeth are seen. It is also a sign of sulfuric acid ingestion. Now let's see the signs and symptoms of sulfuric acid poisoning. So when the patient takes sulfuric acid through the mouth, it first comes in contact with the lips, and the lips become swollen and black and excoriated. If they take through a spoon, then the injury to lips will be avoided. Then it reaches the tongue becomes swollen, sodden and black, and the teeth become chalky white. Then it comes in contact with the pharynx, so pharyngeal pain is the most common symptom, and then along with that there will be edema of the glottis, odenophagia and dysphagia. Odenophagia is pain while swallowing, and dysphagia is difficulty during swallowing. If it affects the voice box or the larynx, it can cause a hoarse and husky voice, and stridor may also be present. And then vomiting will be there. The vomiting will be acidic and it will be brown in color, and it may have contents of gastric mucosa because there is corrosion of the lips, esophagus, gastric mucosa, everything. And the mind will be alert during the whole time. Sulfuric acid can cause death. The dose which causes death is 10 to 15 ml, and the fatal period is 12 to 24 hours. The most common cause of death is circulatory collapse. When sulfuric acid comes in contact with anything, it will erode it. Likewise, when it comes in contact with the blood vessels, it erodes the layers of the blood vessel, causing leaky capillaries, because of which the blood leaks out of the capillaries, and there is hypotension and heart failure. The next cause is edema of the glottis. The glottis gets edematous, which causes respiratory tract obstruction. Then it can cause perforation of the stomach and spilling of the stomach contents into the peritoneum. That causes death. Again, there can be toxemia also. Then delayed death is caused because of renal failure, pneumonia, infection and starvation. Now let's see about the complications of sulfuric acid poisoning. Acute and chronic complications are there. Acute complications, the first one is the upper airway obstruction. Upper airway obstruction can occur because of the edema of the glottis. Then GI hemorrhage and perforation can occur when the sulfuric acid comes in contact with the stomach or the esophagus. Then sepsis can occur because burns predispose to infection, and then atelectasis can occur, which is the collapse of lungs. Then chronic complications are esophageal obstruction because of stricture formation. When the acid attacks the esophagus, there is necrosis of the esophageal mucosa, after which the healing occurs. During the healing, stricture formation occurs, because of which esophagus gets obstructed. Same thing happens with the pyloric area. It causes pyloric stenosis, and then vocal cord paralysis and with the airway obstruction may also occur. In this picture, on the left side you can see the esophageal stricture, and on the right side you can see the pyloric stenosis. Now let's go to the treatment of sulfuric acid. Since sulfuric acid is an acid, it can be neutralized by alkali or basic component. For neutralization, we can use 1/4 of a liter of water, or milk of magnesia, or lime water, or soap suds, or aluminum hydroxide gel. This has to be given within 30 minutes of ingestion of the sulfuric acid. There are two contraindications. You cannot do gastric lavage, and you cannot use bicarbonates. Gastric lavage will cause spread of the sulfuric acid to more parts of the GIT, and the bicarbonates cannot be used because sulfuric acid has a special property. It can carbonize compounds, so it means it will release carbon dioxide. So if bicarbonates is given, then it will release carbon dioxides, which causes gastric distension and then rupture. Because the gastric mucosa is already weak, it will be prone to rupture. Some of the other contraindications of gastric lavage are unconscious patient, volatile poisons like kerosene, esophageal varices, marked hypothermia, bleeding disorders, and convulsant poisons. Some of the other modes of treatment include demulcents. Demulcents are substances that reduce the irritation. So example are egg white, milk, mineral oil, olive oil, starch water, melted butter, etc. Prednisolone 60 mg per day can be given. It should be divided in doses and given. It prevents stricture formation, but there are a lot of risks to this. It can predispose to infection, so it should be used carefully. Investigations are, we can do flexible fiber optic endoscopy. It will let us know the extent of damage to the stomach. If second or third degree burns are present, we have to do explorative laparotomy, and if necrosis is present, then esophagogastrectomy has to be done. In case of complications like stricture formation, a 4 cm diameter mercury filled boog should be passed through the stricture. Then in case of edema of glottis, tracheostomy can be done as an alternative pathway for ventilation. And in case of skin burns, a paste made up of magnesium oxide or sodium bicarbonate can be used. And in case of eye burns, the eye should be irrigated with sodium bicarbonate or water or normal saline. In this picture, the left side shows the reaction of the eye to chemical compounds, and in the right side it shows the skin burns due to sulfuric acid. Postmortem appearance can be divided into external and internal. External postmortem appearance is very simple. There will be necrotic areas and they will appear greyish at first. Later on they will become black and leathery. Internal postmortem appearance, you can see that the damage has been done mostly in the upper digestive tract and the respiratory system. In esophagus, there is a stratified squamous epithelium, and squamous epithelium is very resistant. So not much damage will be done, only a superficial mucosal reaction will be seen. But the stomach has columnar epithelium, which is more affected by the sulfuric acid. So the stomach will present as a spongy black mass and it may disintegrate on touch. All the damaged mucosa become brown in color, and the blood also becomes dark brown, because when the sulfuric acid reacts with the hemoglobin, it forms acid hematin, and the color of acid hematin is dark brown. Calcium oxalate crystals may be seen, and perforation in the GIT may occur because of the necrosis of the esophagus or the stomach. And if there is a necrosis of the stomach and perforation has occurred, then all the chemicals will spill into the peritoneum, which causes chemical peritonitis, and it may also affect the visceral organs and cause liver and kidney swelling. And if sulfuric acid comes in contact with the diaphragm perforation may also be seen. In some cases, no acid will be found in the body because the body would have broken down all the acid into normal contents of the body. So this usually is seen after 2 days. When a person is found dead after sulfuric acid poisoning, it is most likely to be suicidal, because homicidal, they won't use sulfuric acid because the local changes and the physical changes will be immediate, and it will be very easy to find the accused. And even if the sulfuric acid is mixed with food, it will show its effects on the food because it's a corrosive poison. And it may be accidental because someone might mistake the acid bottle for castor oil or other liquid and drink it mistakenly, but it's mostly suicidal. And it can also be used as an abortifacient by injecting it into the vagina, but this is very rare. In this picture you can see a person's face which has been disfigured by an acid attack. This is called vitriolage. So vitriolage is the throwing of sulfuric acid on another individual. It can be done because of jealousy, or it can be done with the intention to harm their enemies. The burns which are produced are painless and perforating, and the burns predispose to infection. The repair of the skin is very slow, and when excessive repair takes place, contracture of the skin can be seen. And when the sulfuric acid comes in contact with the eyes, blindness may also occur. It need not necessarily be sulfuric acid. Other acids or alkali may also be used. Now let's see the laws which protects the victims of acid attack. In section 326A, it states that when the person is throwing the acid with full knowledge that it will hurt someone, and with the intention of hurting that person, then imprisonment can be given up to 10 years along with fine. In section 326B, it states that when the person is throwing acid or attempting to throw acid without any damage occurring to the victim, then imprisonment can be given for 5 to 7 years along with fine. The treatment is the same. For skin burns, you can give a paste made up of sodium bicarbonate, and for eye, you can give irrigation with sodium bicarbonate or water. Thank you for listening to me. If you like this video, please like, share, subscribe and comment on it. Thank you.